whatever happened yesterday in so many few words. We exactly know, instead of sitting through the whole session, we exactly come to know the whole, the gist of what had happened yesterday. Thank you so much. And thanks all the moderators for their wonderful moderation of the sessions and also informing us what exactly happened yesterday. And it gives us a push for what we should be doing today. I would like to invite Samir onto the stage.
I remember feeling really afraid 2 years ago when I was gasping for breath, feeling like, I didn't know what was happening to my body and I was no longer in control. I consulted lots of allopaths, the family doctor, specialists, they ran a whole bunch of tests. They said that I was allergic, probably to dust, but that it couldn't be fixed. And so I decided to consult a homeopath. He told me to start yoga. I had to incorporate exercises for my lungs within everyday regular activities. I have young kids, so he said, blow balloons every day, that will help strengthen your lungs. And with homeopathy, it's mind plus body. So you're playing a more active role. You're observing, you're making changes, you're reporting back, you're checking in. And particularly pranayam in yoga, and to make sure that it's something I did every day. Not just to strengthen my lungs, but also to de-stress. This entire journey with traditional medicine has made me realize that there is a very strong connection between our mind and body. You have a role to play in your own health. You can make choices that impact how your body reacts or responds or heals. A lot of it is in your hands, and I love that.
The most stressful part of what I do as an athlete is that first round jump when I'm at the top of the runway. Being based in the UK, being born and bred in Manchester, I have certainly been brought up with a very conventional mindset around medicine and healthcare. I'd literally had 2 years of incessant injury, 2 surgeries within the space of basically 12 months. And I'd had enough. I really wanted to seek out healing, and that healing wasn't just a physical healing, it definitely was an emotional, spiritual, mental healing. Some of the important practices that I do personally to focus on staying healthy would be making sure that I go out and do my meditative walks in the woods or in the forest, even in the park nearby to my home. I think it's important that we realise that conventional and traditional medicine can go hand in hand. You can't keep giving, going hard 100% of the time, because ultimately you're going to burn out. I have this rhythm of rest, recovery, performance, rest, recover, performance that is part of my day, my week, my month, my year.
What has been for centuries the integral source of health for people and communities, what is still the first port of call for millions of people worldwide for their health and well-being. Its traditional, ancestral, and indigenous knowledges of health and the world around us, constantly evolving, in balance with self, in harmony with nature. But how can we harness its potential to help us address the health challenges of our busy lives? To turn the promise of health for all into a reality for all. To deliver people-centered health services that are respectful of cultures and traditions. By sharing our knowledge and experiences of traditional practices, we can understand, acknowledge, and advance its role in building a fairer, safer, and healthier future. Respecting the wisdom passed down from generations and embracing science, technology, and innovative thinking. Blending traditional and conventional, underpinned by robust evidence, innovation, new technologies, and sustainability. Imagine if we combine the best of the modern and the best of the ancient to support harmony with self, societies, and nature. It can be done. Together, we can embrace the potential of traditional medicine and create a healthier, more sustainable, and balanced world.
Namaskar, good morning. I'm starting in the trend of Namaskar. I should be saying that more, and I'm saying that we are not doing that often. Namaskar again. My name is Samir Pujari. And also in the spirit of being from Switzerland, I'll say bonjour to keep the spirit going. I work with the World Health Organization, and I currently lead the work on artificial intelligence for health. Now, a lot of people get scared at that point when I say artificial intelligence. But as WHO, our key mandate from the DG is to try and make sure that WHO is looking ourselves and keeping ourselves at the frontiers and keeping everything available to facilitate science and public health. And I'm very excited today that at the second day opening of this session, with the whole discussions filled with optimism, we are here to start off the discussions on how artificial intelligence can be leveraged for healthcare, especially in the domains of traditional and complementary medicine. I'm very happy to also say that this is not for the first time we're talking about it. Under the leadership of several leaders who will listen to today, for the last 1+ year, we have been discussing and looking at different opportunities, different risks, different challenges of how digital frontier technologies and artificial intelligence can be used and leveraged to bring the knowledge of traditional and complementary medicine at a rapid pace to a broader scale up opportunities. So with that discussion and thought process in mind, we will now go into the panel discussion. We will have 3 parts in the panel discussion. The first one will be hearing in from leadership on how artificial intelligence has the potential to grow in the future. Then we will go into a short presentation of what we have been doing for the last 1 year with several groups of experts. And finally, we will then dig into some examples and discussions before opening up to panelists for to sort of have questions and answers around this session. With that, let me have the first, it's my honor and humble pleasure to request and invite a thought leader who has initiated this work at the beginning of the onset of things and whose visionary thought process on artificial intelligence in traditional medicine has led all the work and has also curated this whole session and discussion. So with further ado, someone who needs no more introduction, please I request Honorable Shri Vaidya Rajesh Koteja sir to please come and give his keynote speech.
Namaskar. A very good morning to you all. I hope that you had good rest after very delicious dinner last night. And there was a yoga session. I believe that so many of you may have participated. So I'm sure that you are deprived of little sleep, but because it is morning, not afternoon session, so it is okay. So the 2030 agenda for sustainable development highlights that the spread of information and communications technology and global interconnectedness has great potential to accelerate human progress, to bridge the digital divide, and to develop knowledge societies. So with the recognition that information and communications technologies present new opportunities and challenges for the achievements of all 17 Sustainable Development Goals, there is a growing consensus in the global health community that the strategic and innovative use of digital and cutting-edge information and communications technologies will be an essential enabling factor towards ensuring that 1 billion more people benefit from universal health coverage, that 1 billion more people enjoy better health and well-being. These objectives echo with the Indic dictum Vasudhaiva Kutumbakam and Sarve Santu Niramaya, meaning let the world be one family, everyone is free of diseases. Digital technology is supporting the paradigm shift from organization-centric to citizen-centric and disease-centric model to integrative, holistic healthcare model of service delivery to facilitate collaborative, multidisciplinary, and cross-organizational healthcare delivery processes. Citizens now see their healthcare experience as a long-term wellness journey rather as a series of healthcare incidents. As a result, individuals are increasingly looking for tools and platforms to help them on their road to a health-oriented, wellness-oriented lifestyle. This is a major paradigm shift in healthcare delivery, which is available by implementing the key principles of USC, wherein all people have access to the full range of quality health services they need when and where they need them without financial hardship also. So USC covers the full continuum of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. I believe that the slides are too complex, so I tried to simplify and not just merely reading the slides, but trying to collate the information in very simple words. Digital technologies are increasingly ubiquitous and the world's population has never been more linked. Innovation is also occurring on an unprecedented scale, notably in the digital health sector. Nonetheless, the potential of digital technology and innovation to benefit public health remains largely unexplored. It is a huge opportunity to extend their usage with a coordinated strategy to health product and system innovation, particularly in low and middle income nations. To bring in the perspective of practical application of citizen-centric digital health in the domain of traditional, complementary and integrative medicine, few use cases are being presented. The first one is Ayush Grid, which is the comprehensive IT backbone for the traditional medicine sector in India and is aligned with Ayushman Bharat Digital Health Mission and India's tech. It is created with a vision to transform the Ayush sector to provide efficient, holistic, affordable, and quality service to all through a secure and interoperable digital ecosystem. Ayush Grid operates at 4 levels, that is core layer, national layer, state layer, and citizen-centric, ensuring citizen access, ensuring seamless digital connectedness between all stakeholders. I must mention that the entire team working with me and leading is here. Our joint secretary who is leading this, Kavita, is also here, and her team is also here, making all this happen at Ministry of Ayush and implementing across the country. The second use case is National Ayush Morbidity and Standardized Electronic Portal. We call it Namaste Portal, which was launched in the year 2017. The portal is currently utilized for the use of National Ayurveda, Siddha, Unani morbidity codes in sync with ICD-10 for now, for counting reason for encounter, RFE, from various Ayush facilities. We are upgrading it to ICD-11 compliance. Further, the portal paved way for the development of TM-based standards under the aegis of international agencies such as WHO, ISO, through Bureau of Indian Standards. Apart from these, Ministry of Ayush is also emulating integration of Ayush procedure codes as part of ICD-11 and this International Classification of Health Interventions, ICHI. Yesterday only I had a meeting with WHO team, and we had discussed at length how we can bring in ICHI code for Ayush systems. This will enable synergistic use of coding and billing for implementation as part of public health insurance initiatives like PMJAY in India and also in private sector. In this context, it is pertinent to note that WHO's International Classification of Diseases 11th chapter has already published morbidity codes for TCM as Module 1 in chapter 26. In continuation of the same and based on the Namaste use case and experiences from other member states, the beta draft of the morbidity codes for Ayurveda, Siddha and Unani systems of medicine as Module 2 is completed and expected to be released by January 24. I must compliment the WHO team looking after this, and thank you for your immense cooperation, and is a good example how we can all different member states work together to achieve certain very good things, outcome for traditional medicine. The effectiveness of creation of such standards and digital systems become relevant when they are employed in day-to-day clinical practice through electronic health records. To ensure the same, we have developed Ayush Hospital Management Information System, AHMIS, which is part of National Health Digital Ecosystem and compliant with Ayushman Bharat account number, that is known as ABA. This is one of the hallmark example of prudent system and digital health ecosystem and integrative holistic healthcare. This is the third use case to showcase the digital health ecosystem in TM domain. I would like to conclude the presentation by bringing in another crucial aspect about digital health, which is ever increasing and ubiquitous use of artificial intelligence in healthcare, including traditional medicine. While holding great promise, this rapidly developing field raises issues like legal issues, ethical issues, and social concerns. That is regarding equitable access, privacy, appropriate uses and users, liability and bias and inclusiveness. These issues are transnational in nature, as capturing, sharing and using data generated or used by these technologies goes beyond national boundaries. Hence, there is a need to catch up with the development of benchmarks, guidelines, and policies for safe, effective use of the same in healthcare. To ensure the benchmarking of AI traditional medicine and not to be left behind, with the guidance and support of UN bodies such as WHO and ITU, Samir Pujari ji just mentioned, Ministry of IUC is also leading a topic group on TM as part of focus group on AI for health. Is a focus group AI for health which is now upgraded to global initiative. As part of these deliberations, we are going to understand member countries' expertise and experience in harnessing digital health technology and creation of digital public goods for sharing across the world while avoiding duplication of effort and resources. This is the high time to commit ourselves for leveraging the benefits of digital health and new innovations to achieve the objectives of universal health care. SDGs towards making the world better and healthier place with the motto of Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha. Thank you and Namaskar.
Thank you very much, sir, for those very insightful and great examples of what has happened and how practically we can take the applications of artificial intelligence to better the science behind TM and the application of those things. And one thing you very clearly mentioned is this is critical that we collaborate in a space to make it happen as fast as possible, and not just within healthcare, but within the different domains. This effort has been carried out, and we have been working with several UN agencies across the board. The UN Secretary General has led this work on artificial intelligence and has also, through his Tech Envoy, sent us a message. So I will now request the AV team to please play the video by the UN Tech Envoy, Dr. Amandeep Gill, on his vision and his message for the traditional medicine and AI space. Video, please.
The world needs innovative, almost disruptive responses today to its most pressing development challenges. Emerging technologies, including artificial intelligence, have a role to play and help us achieve the sustainable development goals and deliver a better life and well-being for all. At the same time, we know that these technologies have risks. AI can amplify bias, reinforce discrimination, and enable new levels of surveillance never seen before. Vulnerable populations, settings, and environments are particularly at risk. In this context, the UN system is focusing on some strategic enablers to harness the opportunities and address the risks. The Secretary General plans to set up a high-level multi-stakeholder advisory body on artificial intelligence to provide guidance to member states and to the international community on AI governance. The World Health Organization, as the specialized UN health agency, has embarked on its own journey to leverage the digital transformation across all domains of health. These efforts were captured in the Global Strategy on Digital Health, which is running until 2025, and more recently, the aspect of artificial intelligence was incorporated into the global initiative of AI for Health. In traditional medicine, we have tremendous potential to achieve universal health coverage. However, we need to bridge the practice and evidence gap in applying traditional medicine to health problems. If we do not have the right bridging of practice and evidence, then individuals can do self-harm and health workers can misguide. So we need to bring tradition and modernity together in new ways to ensure that the use of emerging technologies in traditional medicine is empowering and is scientifically backed. This summit is an opportunity to bring together different stakeholders and reinforce the UN's approach to health for all, which incorporates alternative medical therapies, thus promoting wellness and enhancing the quality of life for everyone. I believe that together we can set on a path towards integrating AI and traditional medicine, and with the highest level of respect and mindfulness for the rich traditions of the ancient sages, as well as the discoveries of modern science. I thank you.
He also asked me to apologize that he could not be here as he wanted to be in person, but he has said that he is committed to take this work forward. Now, going forward, I will request all the panelists and the speakers to come forward to take this discussion further. But I want to say, artificial intelligence is here. It's here to stay. We have, as a community, the opportunity to either leverage that or steer away from that. As WHO, our DG has mandated us to look at what are the best safeguards that can be put in place to make sure that AI can be leveraged at the maximum level. What we will do now is give a small presentation on what has happened over the last 1 year, not just in the space of traditional medicine as a holistic approach of artificial intelligence, and then also some examples on AI and traditional medicine that have been leveraged. And with that, I would encourage all of you to be part of the discussion. You all have questions, comments, so please come and join in. This is the opportunity to discuss what can be done, because we will set the stage from here as we go forward today. Now, let me start off with a small video to show the introduction of what potential we have, and then invite, in the meantime, all the panelists to please come on the stage as well. Video, please, introductory video.
In a world where health is a universal aspiration, traditional medicine emerges as a vital complementary solution, bridging gaps and enriching lives. WHO defined traditional medicine as the sum total of the knowledge, skills, and practices based on the theories, beliefs, and experiences indigenous to different cultures. It is used for health maintenance and treating physical and mental illness, intertwined with cultural practices, making it invaluable and heritage-rich. Traditional medicine is widely practiced in low and middle-income countries, with approximately 80% of the population in certain Asian and African nations relying on it for primary health care. Globally, 88% of all countries embrace various traditional medicine practices, including acupuncture, yoga, herbal medicine, and more. It is deeply ingrained in the lives and beliefs of millions, enriching the health of communities across rural and urban settings. As traditional medicine continues to evolve, embracing innovation becomes crucial. The explosive power of digital technology, particularly AI, emerges as the bridge connecting tradition to cutting-edge healthcare, supporting diverse interventions, revolutionizing research, drug development, and medical training. With its incredible potential, artificial intelligence is reshaping the landscape of traditional medicine, revolutionizing patient care through collaborative innovation. Artificial intelligence analyzes the chemical composition of herbal products, ensuring authenticity and safety. Personalized treatments are now a reality thanks to AI, elevating precision in care. AI-driven diagnostic tools efficiently assess symptoms for timely and accurate diagnoses. As we embrace AI's potential in traditional medicine, empowering practitioners with AI expertise transforms patient care. But despite the many opportunities, there are still challenges that remain. Limited investment in digital infrastructure hinders full engagement with AI's potential. Accredited technologies need proper education and regulation for safety and quality. Traditional medicine data gaps limit the applicability of AI-based methods. WHO is working with partners to tackle these challenges and shape the roadmap for the future. embracing holistic wellness and quality of life through ethical use of AI for traditional medicine and AI for all.
Thank you. Slides, please. So as I mentioned, we have set the stage. We've got some great guidance about this. But this is not something that we're starting today. This has been something which has been ongoing, the work on AI for the last 5 years. Since 2018, the Director General, when he spoke at the Global AI for Good Summit, he asked WHO to create a work stream and discussion around how AI is being leveraged for healthcare. And that led to the creation of a working group between WHO and ITU. Now, for those of you who do not know ITU, it's a very common term. ITU is the UN Specialized Agency for Telecommunications. They are the UN agency that works on telecommunications and IT. And as has been repeatedly said, AI cannot happen for health, cannot happen without collaborations. We do not have the skill sets spread out. So that's why we have been collaborating with the AI in the tech industry, together with them holistically, to try and understand where the science stands. So since 2018, with over 100 plus partners now which have been engaged, we have been looking at 2 sets of artificial intelligence guidance documents. One is cross-cutting areas, ethics, governance, regulations of AI, how these can be put into play, and facilitate countries to use these at the right level. And the second part is vertical domains, is looking at AI in specific disease areas to facilitate UHC, AI in TM, AI in chronic diseases, AI in mental health and areas. So how can that be applied? So the focus group has been working for first 5 years on discussions around this. One of the working streams which was created was under the leadership of Ministry of Ayush on the TCM, and that has grown rapidly with expertise and experts providing inputs to it, which will be presented briefly. The work of this focus group was just July, 1 month ago, literally converted into a global initiative where we now have WHO, ITU, and a third UN agency, the World Intellectual Property Organization, as well joining into a global initiative on AI for health to help facilitate and enable AI to be taken to the people. How can be delivered to the people? And there are 3 main pillars to the global initiative. The first one is WHO in its normative role will continue to lead developing guidance on different aspects of artificial intelligence, standards, policies, whether these are regulations, these are norms and standards for cross-cutting areas as well as vertical areas. So that will be the role of WHO as a continued process working with experts to continue developing this guidance based on needs of countries. The second pillar is bringing together partners, academic institutions, regulators, researchers to help blend science at the rightful level into the artificial intelligence space. The facilitate function is where I am opening up to every researcher here, every person who will be working on artificial intelligence to come join hands so that you can do 1 + 1 = 11 rather than adding on slowly and steadily. There is much more power in collaboration. So the facilitate pillar will focus on bringing together different stakeholders in collaborating in the area of artificial intelligence in the specific domains. And it's everyone, whether it's a small startup to a big tech company, to researchers, to academic institutes, where WHO will be sort of the threshold to look at it. And the third one is actually taking AI to the people, is to help governments implement AI, the rightful science-driven, evidence-based, non-biased AI to further help speeding up the implementation of better healthcare services at the country level. It's an enabler that we want to use AI as, and these are 3 main pillars that will be used for the global initiative on AI for health. We already have guidance which has been released over the past several years, and this is available again for different stakeholders. The guidance is not a theoretical document. It has very practical checklist-based approaches for healthcare providers, for governments to understand how they can deploy and use AI, as well as for developers this time. We have also guided the industry which is creating the products to inform them how they should take an approach on ethical and regulated product development for artificial intelligence. So WHO, as I said, will continue to develop these norms and guidance, but there is already a lot of guidance available, and also training modules which have been created out of this. As I mentioned, we'll be having a lot of work streams ongoing, but I now request Dr. Saket, who is leading the work on the topic group under the Ministry of Ayush leadership, to give specific examples of how this has been applied so far and deployed. Dr. Saket, over to you.
Yeah, thank you, Samir. It's a great honor and privilege to report what we have done from the work topic group. As Samir has said, it's been a rigorous around 1 year work with various stakeholders across the world. And I would like to thank Vaidya Rajesh Kotecha sir again to really identify this gap, and he has volunteered. And it was a great hardship to convince ITU and WHO to take traditional medicine on board, but somehow it could happen, and there's a good progress in that. So, So we have basically identified, these are the few areas where there is some groundwork has been attempted already in terms of harnessing basically utilization of data to begin with, and also to some extent some trials have been done to come up with some algorithms and utilize the artificial technology. Here, instead of saying artificial, where it's added with TM, it can be an augmented sort of intelligence. I mean, it's sort of enhancing what we already know. So here, the first one is the ontological and epistemological analysis. This is the crux where actually, even yesterday also, we had heard this concern from various leaders in this domain, how to bridge this gap. It seems to be a very large gap, but basically it's a continuum. I mean, that to establish that continuum, AI definitely helps. Because if you can see simple example of Google, sometime back, handling so many languages was an issue, but now with something like UTF-8 and all, we can handle literally any script now. It has become system agnostic and computer agnostic. Anybody can see any kind of a script. So that kind of a leverage, continuum we can maintain, and we have seen in our day-to-day practice. For example, the terminology document itself is a best example how we can simply bridge the gap by simple translations, not losing the sheer uniqueness of the traditional medicine. That's handled in the ontological epistemological area, where computational tools are really aiding us. Second is analysis and integration of TM data. Now we get data from various data points. Individuals are using variables, a lot of data in terms of auditory files, audio files, images, many things are there. So now we have computational ability to process that and put it to the context. Earlier, we know the paradigm shift of earlier experimentation was very much controlled. Unless you are controlled, you are not able to do the experiment. I mean, that limitation is now we are able to surpass. It was like population level study, sample size study. Now we can envisage the population level study. Thanks to the computational ability, during COVID, we could do that. I mean, entire cities were like sort of digital twins were made, and we could actually predict, especially in terms of COVID vaccination, we could see what should be the gap between first and second dose. It is possible now. And that is the third part, that is a predictive and decision support. Patient follow-up, as we have very good electronic health record systems, and just now sir's presentation, we have seen how seamlessly from primary, tertiary, secondary and tertiary level, how we can seamlessly continuously monitor and give this power of record to the person. I mean, that's a kind of leverage we have, and putting artificial intelligence is ice on the cake. I mean, it will only augment the operations, and it's only going to add a value to that proposition. And finally, of course, all this will add up to research, because we have to have this credibility, science-based things, what we are talking about. All this accumulation will ultimately lead to research and discovery. And of course, we have colleagues like Bhavna Madam here who have used AI to sort of meaningful way to actually have personalized medicine like Prakriti and other things. Ma'am will take care of that. So a few examples, I will quickly run through these slides. This is just very few examples at tip of the iceberg. So we have a work from China where they have tried to sort of process electronic health records and prepared the data sets and applied AI algorithms on that. And this human-centered patient care, now we can envisage by actually analyzing the existing data and training the machines to help physicians further to actually streamline the information to begin with. The information is there, but it's quite scattered. So there's a possibility that we can put it to the meaningful usage by use of AI tools today. Second is we have this bridge between the biology, the medicine, and the traditional medicine. As I said, it seems to be so wide, but when we actually dig deep and start working, it is not so actually. Now in India, we have examples of Prakriti being sort of linked to the epigenetics and other things, and elsewhere also these items are very successful. So in that, the Korean example stands very well. They are trying to map the biological markers and other things with the traditional medicine thing along with the cheminformatics. This is possible. And in India case, we have a great example, thanks to Arijit Samal from Institute of Mathematical Sciences, Chennai. It's a DAE organization. He has come up with a fantastic database of chemicals specifically to the Indian plants, and also added the bioinformatics tools on the top of it. So what we have to do from the ministry or say from Ayurveda side is to put the Ayurvedic information and see how they make sense. If I have to say, for example, Madhura Rasa things, what kind of chemicals are there, what kind of biological markers we can link to. It's a matter of connecting the dots. I mean, now it is envisageable. These are the available data sets, so on which we can build upon further AI capabilities. Sorry. And TKDL is another great example where almost from last 15 years, great amount of knowledge has been digitized. It's one of the hallmark examples how we prepared. It's not in the future. I'm not talking in the future sense when I'm talking about AI here. The tools are there. It's a matter of just adding a little edge of the technology and the computational capabilities so that we can start making sense of all these tools. So, but this is not an easy job. AI, I said, but there are a lot of apprehensions about AI and how whether it is going to be productive or counterproductive. Here, the main concerns with traditional medicine are, one is, of course, it is known, lack of established or benchmarking framework, which we are already working on, insufficient engagement and recognition from health community. Of course, this is an apprehension we all share, but we are here to mitigate that. Growing socio-economic conflicts. This is a very big problem, especially lower and middle income countries, and that digital divide, all that comes into play, I mean, full-fledged here. I mean, that divide is equally applicable here also. And of course, the safety concerns and standardizations. So here, these are the three areas where we have to have this balance when we envisage this powerful technology like AI, when we utilize in the traditional medicine. One is exploring the very specific objectives that we have to do anyway, ensuring safe, effective, and integrative treatment modalities. So when you are working this transdisciplinary approach, we should be cautious. What we are talking to each other, whether it's making sense or not, and how it's going to reflect on the person's life or say community's life. That's where we have to think about the safeguards and the uniqueness. And this comes with another challenge where we have to keep the traditional medicine practitioners' sensibilities in place and make them a part of this discussion. Generally, it should not happen in the isolated labs, and without their participation, if this happens, again, that's going to fail. In the sense, before I pass on to my next speaker, video for Ursula, I would like to say that if the community doesn't understand what is this technology and what are the implications of it, not on the technical side, on the actual real application side, and if they're not part of this discourse, this effort is not going to be of much use. I mean, with that note, and with the intentions and the leadership we have, I'm sure there's no questions or confusions about it that we're going to deliver on this. And with this, I will stop here and request the video of Ursula Zaho to be played, where the topic, the challenges of AI integration will be discussed further. Thank you so much.
The policy brief also offers insight in potential challenges when integrating AI in traditional medicine. For example, there is lack of investment in digital infrastructure and literacy where the traditional medicine is usually involved. There's also lack of representation of traditional medicine elements in the AI training data, as well as lack of considerations of traditional medicine in centricity in regulation of patient data, as well as progress of quality assurance. The health community where traditional medicine domain is involved is rarely involved in the co-design and the co-development process throughout the entire life cycle of AI. To tackle these challenges and associated risks mentioned previously by my colleague, the document also offers potential policy actions for policymakers that might be useful for their actual practice. For example, it is very critical to integrate AI into traditional medicine with an ethical and a safe manner. That includes but not limited to designing and integrating regulatory frameworks with considerations on documentations and transparency, intended use of clinical validations, data protection, privacy, as well as quality, and engagement and collaboration. It is also important to provide specific, domain-specific, and context-specific literacy for health workers, patients, and other healthcare stakeholders. So to raise their awareness towards health personal data rights as well as algorithm usage. For research where use of AI is involved in the traditional medicine domain, it is also important to monitor and evaluate its efficacy, safety, and ethical implications. The final publication of the policy brief will be available at the end of 2023. Moving forward, we promise to engage different actors within the ecosystem of traditional medicine as well as digital health. We strive to preserve the knowledge and practice in the use of AI for traditional medicine in a responsible, ethical manner, and finally, to promote holistic well-being and health for all. Thank you for your attention.
Thank you. So that was just to set the stage as what has happened. Now we have also on our panel very elite panelists who are actual practitioners. So we have discussed about the policy, we have discussed how this work has evolved with the different experts and their inputs. But today we have on the panel some of the really elite panelists who have actually been taking this to action. We have Dr. Bhavna, who's been doing research and science behind use of AI in TCM. We have from Bhutan our colleague who has been actually taking implementation, Dr. Karma, at the primary healthcare center level, at the hospital level, implementing traditional medicine and digital solutions and artificial intelligence with us to discuss. We have Dr. Roshnak, who's been studying from Iran, artificial intelligence and traditional medicine. And we have Dr. Devina, who's been from Mauritius, who's looked at biotechnology as an opportunity for different domains of healthcare and agricultural world. So I'm going to ask you some very, very optimistic and encouraging questions. I want to use the right words here, but to instigate us also to see where the opportunities for artificial intelligence and traditional medicine, but also where the risks and what safeguards need to be put into place. So Dr. Bhavna, let me start with you first. What opportunities do you see for traditional medicine practices through the integration of AI and digital technologies? Can you share some of the work, any examples of what you have done so far, and what are the challenges there?
So traditional medicine practices, as we all generally understand very clearly, is that they have a lot of preventive scope as well as personalized scope. So when we say personalized scope, it has to be both diagnostic as well as therapeutic. And the link between the personalized diagnostics and personalized therapeutics is what is the crux of the traditional medicine's unique aspects across all different traditional systems of medicine. So Ayurveda, which is an Indian system of traditional medicine, it also describes personalized and preventive as well as predictive health. It defines health using the multi-system parameters, and it also incorporates and accommodates the inter-individual variability which is observed even in the presentation of health features, which actually demands or it's reflective of an internal biological patterns in the individual. And these, if captured and are harmonized with the corresponding lifestyle and diet, they can actually provide for the personalized preventive as well as therapeutic interventions. Now, the question is, how do you analyze those patterns and whether there are any set methods for those? So in our experience, what we have done is understand this baseline patterns of an individual, which is called as Prakriti, and we do it across different geographical ethnic populations to identify what are the common patterns and what are the geographical variations. And we have applied the machine learning algorithms to identify important features as well as the patterns which can actually provide for the recapitulation of the entire system, that physiological understanding of the variability, which a physician would do, and how that has been learned by the machine to be able to provide on a scalable basis. So that's the example I would like to say.
Can I just ask again for a common perspective, how does this help? How does this help in changing the dynamics of traditional medicine to common physicians? The work that you're doing, this, I mean, the genomics work, how does it actually complement and benefit the end user?
Yeah, so complement and benefit user directly as well as the system or a science also. So for example, if I say somebody is of one Prakriti versus the other one is the other Prakriti, what does it mean at a scientific and multi-omic level? And does it hold any importance in biological terms or a genomic or a molecular terms, which will explain to the global audience also that when I say certain Prakriti, does it mean it has certain responsiveness to environment or responsiveness to drugs or responsiveness to disease progression. So that's about the global connect as well as this connect with the contemporary science. As far as the user is concerned, user gets to know and gets to participate in his or her own self-care through understanding Prakriti and understanding the nature or the relationship with the environment. What should be taken, what should not be taken, what kind of diet to be preferred, what modifications to be done. So the involvement or, the participation of the person in their own health self-care can be ensured.
Thank you so much. That's exciting. There's an opportunity there. Dr. Devina, coming from the engineering side and the technology side, and from African region, can you give some examples of how this has been applied and where's the opportunity for artificial intelligence in healthcare domain space?
Thank you, Samir. So in African region, I would say majority of the people use traditional medicines. So at a very baseline level, for me, the accurate identification of plant is very crucial. Because plants, they look very similar. I have been working with the mascarene aloe for 7 years, and I still fail to identify them properly. So now imagine someone taking a plant, the wrong one. It will lead to toxicity or any other adverse effect. So we can leverage AI tools here to identify plant correctly. And this is also very important because some diseases, such as sexually transmitted disease and mental disorders, are still taboo in many communities, especially in Africa. So people tend to self-medicate. So if they choose the wrong plant, it's not good. So AI tool will not just help to identify the right plant, but also will help those people to choose the right treatment. Also, AI tool will help to break barriers, communication barriers. Say, one country may have many tribes. For example, Zambia has around 72 tribes. They have different languages, different dialects. So the AI has a power to break that communication barrier, and especially between the communities and the traditional healer. Also, it will help in telemedicine and remote care. So if those communities, those people have access to the technology, they will be able to have access to the right treatment when it comes to traditional medicines. Thank you.
Thank you. Thank you. I mean, we have heard great optimism things. I think first thing Dr. Bhavna said was there is already happening broader outreach and broader prevention, and you're saying it's facilitating equity. Let me go to Dr. Karma. I mean, you are sitting daily on this mechanism where you're dealing with primary healthcare sort of services. How do you see the value of AI? What can be done? What needs to be done to actually make it, to facilitate it? Is it actually possible? Is it helpful that technologies can benefit work, or is it more a hindrance? What is your practical approach towards looking into this thing?
Thank you. from my point of view, in Bhutan also, no, we, in Bhutan, we have primary healthcare and secondary, tertiary healthcare. In these cases that, every hospital, every, the tertiary level, secondary level, primary level that we use, manually reporting systems, and then, patient intervention system, there are currently using manually. It's very, very difficult to, sustain. Therefore, I'm, fully, strongly believe that this AI, intervention and the digitalization would be very beneficial and very, useful for traditional medicine, because traditional medicine in terms of, productions and, formulations and diagnosis and, there are so many things to be, incorporated. Therefore, I strongly believe that, this AI, artificial intelligence and the digital technology could bring traditional medicine into the, a very, very useful and then, sustainable way.
Thank you so much. So what you're saying is there is a potential to enable further gaps or build up the gaps which are sitting for the healthcare services from AI. Dr. Roshnak, let me go to you as a researcher and academician in Iran on academics world. There's a lot of research happening on AI. What can be done to facilitate that? Where are the challenges in terms of AI? What are the opportunities that we can provide? What can this global community of work help as a policy group?
For increasing accessibility.
In AI for health, yes.
Okay. Thank you for your good question. I think.
Can you please hold up your mic? Can you hold up your mic? Thank you.
Yeah. It's in my point of view, it's very important to focus on infrastructure because infrastructure investment can help low resources setting to have more access to traditional medicine, especially settings that traditional medicine is their first primary healthcare. And also, I think it's important to have culturally training programs or culturally training sensitive trainings and capacity building programs that could help traditional medicine practitioners to adopt with new AI systems and also I think user interface and instructions should be simple and even in local language till even people with low digital literacy can access to standard AI tools. And also, I think a policy investment is very important. Something like subsidies can help AI developers and technology companies to promote free or low cost standard AI tools that can be easily accessible for even for disadvantaged group. And my final point is it's better to have a participatory design for AI tools that can evolve every community, TM communities in designing AI tools because we after that we ensure that all constraints and needs are seen in these finalized AI tools.
Thank you, Dr. Roshnak. Let me go to action-oriented with the same, if you can also respond. I'm going to have one more quick round of questions. We've spoke about what are the opportunities, where it leverages. Now I'm going to take a little bit detour and say, what action can we take? Now here's my challenge to all the panelists, and this is not in your session script or anything. We have to come here in 1 year, let's say, and Sir invites us, say, this next summit. From today to next year, what is that one thing that you would want to have achieved with this group in the space of AI for healthcare? What can we do so that we can come back as the same panel next year and say, Last year we came here and we said something that this needs to be done, and we want this to be done with working this thing. So what are those one thing that you want to achieve that will facilitate your work or your area of work in terms of AI healthcare and take a leap forward?
Okay. Because I'm a university teacher and academic member, I also engage with students, and I also think the AI usage in training and practice. I think if we have one achievement for next year, it should be about improving or enhancing training methods and using AI in training methods or even in research. For example, we can use simultaneous virtual patient simultaneous examination. In this situation, we can use virtual patient for training students. They can take histories, perform examinations, and order tests, and finally make a treatment decision while they receive real-time feedback and guidance. And this also we can use AI AR headsets for training hand practices. For example, ilaj bit tadbir or ilaj bit yad in traditional medicine. That can help students to do surgery without any carcel and increase their precision during the procedure before they enter to real world and encounter with real patient, I think.
Thank you. So the learning capacity is through AI. That's the request. That's great. Thank you. Dr. Karma, I mean, you are in the field. What is one thing that you want to change? What is the pain point or one wish list that you want to have implemented? And this is also a message for the whole crowd here, who there are people who are developing, there are policymakers. So how we can facilitate that one wish list that is the main pain point? What is one thing you would want to have achieved in the next 1 year in the space of AI and TM?
Of course, there are a lot of the limitation with the technology and challenges, facing many problems. But however, I'm strongly recommend that that AI technology and the digitalization that can boost our traditional medicine system and in international level and national level. Therefore, I would suggest in the international level that we need to have some kinds of open collaboration region to region, and then we have to have some kinds of information sharing. This could lead, very effective, the intervention. In national level also, that we have to have policy framework and financial incentives and all this, that could be, we would be recommend to the government, and then we finally come to end in successful program in these interventions.
Thank you. So you are calling on people to have at least one collaboration to facilitate AI sharing and AI solution tools. And I'm marking these in my notes as well so that we can keep on coming back to you and seeing how we can help you in moving forward. Dr. Devina, from a biotech world, how do you think, what can we achieve next year?
For me, it will be the way we are working. Like, we should stop working in silos. So one thing I want to see next year, that we have traditional healers, pharmacologists, biotechnologists, geneticians, the tech people working together, like in the same room, working on a project, coming with a plan, so that we can really come up with a solution for unmet needs. It's just not about traditional medicines, but also about finding new drugs for unmet needs. So this is something I want to see next year.
Very easy tasks, all of them. And Dr. Bhavna, over to you.
a couple of things which, as a preparatory or a prerequisite that one needs to have in place before we actually have a lot of outcomes coming out of this application of AI is developing ontological links across different TMs. And when I say that, as I mentioned in my earlier discourse, that traditional medicines, the crux is in the personalized recommendations, both for prevention as well as for therapy. And that goes with certain minimum standards in clinical reporting, in the sense that certain minimum things about a patient or an individual to be taken care of. Every system of medicine has got a certain crux things to be asked. And if that common crux is actually arrived at in terms of data reporting standards, and it can be like, there are several descriptive variables, but every system has got certain clustering based approaches to identify and classify or provide that variable according to their terminology so that they can prescribe the medicines accordingly. But nevertheless, the descriptive variables remain the same. It's the clustering is different from systems to systems, and that can enable a lot of ontological links. I think so. The digitization part that we saw in the Namaste portal or in other systems, that can enable that kind of ontological connects, and then minimum reporting standards, which will not only be for the sake of reporting, but they are the decision points for prescribing, selecting, or guiding the therapeutic course. So I think once that is done, lot of subsequent outcome-driven things can be analyzed, and that can be achieved.
As a scientist, you're basically thinking of smarter data that will help analyze things. Sir, let me ask you also, since I'm pretty on the spot, what is one thing that at your level you would like to see achieved so that all the panelists can come and say that we have done this?
Actually, tangible, in the perspective of tangible outcome in 1 year, I think, I mentioned about this AHMIS, Ayush-Bed Health Management Information System, that we are now incorporating AI tools into it, and will come back with a new version with some AI-enabled technologies integrated into this solution. And this solution, I'm happy to share that we are creating this solution on shareable platforms. So we'll put those things into the sandbox so that people can use it, and then we can collaborate more and more. So thank you so much. It's an open access software. Thank you.
So with your permission, just I want to add what Sir has said. Actually, our low-hanging fruit is the sort of harmonizing the supply chain, which we have a lot of tools already available. So in AHMIS, we have this inventory module now. So as Sir has mentioned, we want to see that how, when we use it in the pan-India scenario, how we can optimize the resource utilization. I mean, that's a big investment actually, which is doable because a lot of supply chain solutions are already in place. And second is the curtailing the fake medical practices in the name of traditional medicine. So we have very good tools available with the sentiment analysis and other kind of things, which is the need of the hour. So that is actually bringing a lot of bad propaganda to the traditional medicine, taking away the credibility. So these things are doable. We need not invent anything. I think that can be done and showcased. Thank you.
Thank you, Dr. Saket. And this is very helpful as understanding. As a moderator, I don't want to say that I will not do anything, so I will also commit and abuse my role as a moderator by saying two things. I think one thing is governance, having the ecosystem. All this cannot be done with the vacuum of governance, proper governance in place. So I think as WHO, our job has been to set up the governance guidance for countries. And the second is the scientific benchmarks, right? So for AI and traditional medicine in general, how this is scientifically benchmarked, and not just through our department, but across the group and Dr. John's team, how scientifically this is validated. I think if we can have that guidance available and come much more stronger next year, I think that would be helpful. Having said that, I think one of the regions where there's heavily being a lot of work is the European region in terms of AI, and it has progressed. And we are humbled and very honored to have Regional Director Dr. Hans Kruger here, who can please guide us and on your thought process or a summary of this discussion, but also your vision going forward for this work.
Thank you very much, Dr. Samir, for the great opportunity. And I must say that definitely so far this summit is far beyond my expectation because we came here from the West in a very big learning mood. But let me first and foremost thank the Indian government for the tremendous hospitality and also wonderful cultural program yesterday evening, which definitely we all enjoyed. And a number of points which I took up so far. So first and foremost from Secretary Vaidya, from your excellent presentation, sir, is the explosive power of digital technology, particularly the AI, emerging as a bridge. I like very much this paraphrase of a bridge, connecting tradition to the cutting-edge healthcare, supporting diverse interventions and also the medical training. Also that as we embrace the AI's potential in traditional medicine, empowering the practitioners with AI expertise transform patient care. This is something that we learned very much in the European region, to empower the practitioners, because if we don't get them on board, then policy will not translate into the practice. And ultimately, that we are working towards the bigger goal, which is embracing the holistic wellness and quality of life. Then from the UN Secretary General's envoy on technology, I withheld there particularly the link with the Sustainable Development Goals, and that this summit is a fantastic opportunity to bring us all together to reinforce the UN's approach to health for all. Then going to the technical presentation, we learned a lot about the global initiative on AI for health, and maybe the two takeaways from my perspective here is to acknowledge the presence of traditional medicine as essential part of the fabric of the local communities. The fabric of the local community is very important, and therefore critical to conceptualize and prepare the traditional medicine in a way that moves beyond mere industrial or commercial gains, and to use it to prevent inappropriate use and harm. Then going to the panelists, I mean, really congratulations to all the panelists. I enjoyed a lot. I tried to be the good listener. Took away from Dr. Bhavana on the both components, preventive on the reporting standards, certain minimum reporting standards. Point very well taken. Then going to our next Einstein Forum ambassador, Dr. Devina, you mentioned something which is a flagship initiative in our European region on the mental health. I'm tremendously appreciative you mentioned this. We are tripling, not doubling, tripling our work on mental health, particularly in the youth. We have more than 50% of our youth in the WHO European region mentioning, and not necessarily going to the extreme on mental illness, but anxiety, depression, not being able to sleep, and the COVID-19 has been very detrimental there. And unfortunately, I have to mention that this taboo and you mentioned that it can help to choose the right for treatment also, but because people, due to the taboo, self-medicate. I think very, very important. Going forward, you mentioned on working across silos, including having the tech people. Actually, this is something we work a lot on, because we see different generations in our region. We have a feminized, little bit aging health workforce, and then on the digital, which is quite male and much more younger generation. And we have to bridge those generations. So this point is very well taken, and let me take opportunity to tell that I took the initiative as the incoming regional director to create the Youth for Health Forum. And in the letter I sent out to the 53 Ministers of Health recently for our next region committee, I asked all ministers to consider to include a youth delegate. Very important. And that's also what the UN Secretary General has in mind when he speaks about youth parliaments. Very important. Dr. Karma, I took away the strong link with the primary healthcare. Thank you. As I mentioned yesterday in the opening, we will have the International Conference on Primary Healthcare 22-23 October in Astana, Kazakhstan this year to commemorate the 45th anniversary of the Alma-Ata Declaration, the 5th anniversary of the Astana Declaration, the 75th anniversary of WHO. So, a lot of celebrations, which actually is very good, because usually we look a little bit at the dark side. So we should not forget to celebrate. And you're all very welcome, 22-23 October in Astana. Very happy to share information. And thank you, Dr. Karma, for mentioning this, which was, by the way, also mentioned by Dr. Puram Singh, my sister, the RD of CRO, because this traditional medicine is so cultural and context specific that we have to bring it back to the primary healthcare. I understood, Dr. Karma, looking forward, that you mentioned on region-to-region collaboration. And my full support, that's actually why I'm here on this inter-regional collaboration. Then, Dr. Roshanak, you mentioned about a number of points. I'm only picking up some of them, but connecting to the general audience and putting attention to local language, easy instructions. This is tremendously important also in our region. I call it to demystify. I used to be health system director for 10 years. And for years, I had a tough time to explain to my two daughters what I was doing. Because we call about inclusive health systems, and this, we have to demystify this and bring this to the people, what we are doing. So I'm your strong partner in that one, and you mentioned also on participatory design of AI tools, tremendously helpful. Looking forward, you mentioned about training, increasing training methods and capacities. Absolutely. Then maybe 3 points. I will not going to give a keynote because I would prefer to list, but 3 keynotes from our WHO European region is that we see digital health as a game changer in healthcare. Actually, I cannot, you know that our region was the epicenter of the COVID-19 pandemic globally. I cannot imagine what we have done without digital health during this terrible time of the lockdowns, really. So it is a flagship of the European program of work. And we adopted, actually the 53 member states adopted last year at our regional committee the first ever regional digital health action plan. We will have our digital health forum in Porto, 5 and 6 September, and you're also very welcome. First point. Second point, digital health transformation means using data to better inform decisions. I always say, if we put bad data into digital health tools, we're going to get bad digital health solutions. That's why I took, I believe as the only one globally in WHO, I merged 2 divisions. I merged the digital health division with the division of data and information, because it is really one. And countries actually appreciate it a lot. Instead of sending 2 expert teams to the country, we sent 1 team. Third and last one, the most important, because this digital health is a very crowded field. And sometimes I'm thinking, what I have to do with our 53 member states, with a bunch of my people, if you have some agencies with hundreds of people. My friends, what our turf is to safeguarding equity and human rights approach. This only WHO can do. And WHO, it's you. It's member states and the secretariats. Because we have to watch that AI digital health does not increase inequities. And this is our ethical imperative, and it comes back to leaving no one behind. Finally, and now I get a little bit stressed because Bruce asked me to, Bruce, our ADG, I'm always very obedient if you ask me something. He said, Hans, you have to finish with singing like the previous WHO colleague, which I have to admit is not my forte. But, you know, Bruce is a very big boss, so thank you, India. Thank you, Secretary Vaidya. Thank you, Bruce, and thank you, Shiyama. Thank you, panelists, and thank you, wonderful audience. Health for all.
Can we have a round of applause for Bruce, please, as well, for asking that? But thank you so much, panelists. We still have 5 minutes, as I've been told, because we started 10 minutes late. And we'll be the first panel to finish on the dot, but we have 5 minutes. So I'm going to open up for questions or comments from the audience if there's something that we can, oh, there's a pool of people standing up there. So can I request you to please introduce, and the mics are floating to you, please introduce yourself and be brief in your question and or comment. And also, if you can beat that singing, I open that also to you. But please start off.
Yeah, it's working? Okay. So I'm Mitali Mukherjee from IIT Jodhpur. One of the things is that Ayurveda has a beauty in diversity. The heterogeneity in making recipes for management of disease, as well as personalization of people for optimizing therapies, right? Now, AI needs a lot of truth data to be able to come up with solutions, right? And for the truth data, you need to have harmonization amongst people who will say that this is normal. Because everybody has a different way of treating the same person and different medicines to treat the same person. So how do you envisage AI to kind of work in this kind of a framework where normalization is not the norm, diversification is the norm? So I just want to have maybe Vaidya Katisha's comment and maybe your other panelists comment on this.
So if I have understood the question correctly, there are several formulations and medications options available for treating a given disease, or even for an individual, there can be several options. So how do you, and if it is to be fed into the AI system, how does one go about doing it? So that's where I would like to reiterate that prescription comes along with some diagnostic norms. So it's not that arbitrarily you choose out of 10, 15, 20 formulations. Each formulation has an indication or a minimum. That's why I mentioned about minimum information about the patient and the disease that one needs to allocate to the given medication that has been given, not only while selecting the therapy, but also later on monitoring the progress of the outcome of the therapy on those parameters. And I think that's very, very crucial, and that's actually heart and soul of the traditional systems of medicine, where you assign, okay, particular variable is present or in a particular amount, or a certain condition is there, hence certain prescription. So I think that connect is what needs to be fed into the data architecture as well, and then that will enable the retrograde analysis or AI-driven pattern analysis. So I think that's very much important to have in place.
So Mitali, I would like to put an example that in herbal medicines or in traditional medicines, there is a huge usage of multi-ingredient formulations. So multi-ingredient formulations are actually multi-target medications where they have multi-target with multi-molecule formulations, and it is still being understood, mechanism of action. But there are a lot of work, I'm sure Professor Patwardhan is here, so he is an expert of that, and he has he did a lot of work in this network pharmacology area, multi-target formulations, etc. So this AI in traditional medicine is immensely useful when we create a huge data sets of different behaviors or different prakriti, for example, and then create a group, create like a a large variables, one group, two group, three group, and within these groups, which multi ingredient formulations can be useful and that can be customized. So there is a huge potential. Of course, there is a lot more to do. Thank you.
So with your permission, I just want to add one point to what Sir has said. So we are going to attempt this in two ways, actually. One is identifying the patterns and feeding that to the AI algorithm. And another is the, large language model-like attempt. Because, for example, my colleague Rakesh is here. We have almost more than 100 Ayurveda texts already digitized. Of course, they are in Sanskrit. But that is so logically arranged. Making a machine learn from that available text. For example, what LLMs does, what ChatGPT is doing is existing text, it is siphoning and it's making sense of in the NLP kind of a thing which humans can understand. So it will be attempted in two ways. We need not wait so long that we have the data sets and the patterns, then we feed into the system. That will keep happening. But before that happens, we are on the verge of developing a large language model. That's going to actually shorten this gap and these are pretty much doable. Thank you, sir.
Dr. Saket. Gentleman behind there, yes, please. Yes, go ahead, please.
Hello, good morning to everybody. I'm a French scholar, but I could see that many people are not using translation tools, so I will try to speak English. I'm a healer. I don't know how many healers are in this room. I'm representing West African Healers Association and Confederation for the 15 countries. And we are very happy to be here. So, since yesterday to today, we learned a lot. We are going back and give report that since 1978, at Atmas, the declaration of the traditional medicine is now, WHO is taking it seriously, as we could see. But the problem we are going to face in our countries, especially in African countries, is that most of the ministers and those in charge of traditional medicine in our ministers are trained in Occidental countries. And their mind on traditional medicine is not to help a lot. But I think from here, WHO have to do something which can change the minds of our country leaders, so that they can follow the new vision of WHO. If not, what you are doing here cannot engage them. I'm telling you the truth, because we healers, what we are facing in our countries on traditional medicine is a small thing. But now, you can see in African countries that countries where the development is developed, it's only the countries where the ministers in charge of the Ministry of Health are interested in traditional medicine. So we are begging the WHO to make it in such a way that on all continents where the traditional medicine is not taken seriously by leaders of countries should change their mind to follow the new vision of WHO. If not, what we said here will not go far. I'm telling you the truth. Since yesterday to today, all you said, nobody of you has never talked about healers organizations. If we healers, we are not organized well, you cannot benefit from us.
Thank you so much.
You cannot benefit from us. So you have to talk about how we, in the countries, the policies and the regulations, will take it in charge to be well organized, so that our knowledge should be, they have the database. Otherwise, all the people are dying. And the knowledge will also die. You will not achieve anything. I beg you, thank you very much.
Thank you very much, sir. Thank you for your comment. And I think, I believe what you said the stage has started, the first global summit for traditional medicine has happened, so people have come together. So your voice is already being heard, I would say, with leaders sitting here on the board. I see there was a hand there on the right-hand side of that side as well. Let me get to...
I have the microphone. Good morning, everybody.
Good morning.
My name is Dr. Anastasia Yorinchi again. I'm the Director for Traditional and Alternative Medicine of Ministry of Health, Ghana. As usual, I'm speaking on behalf of African Traditional Medicine. Concerning country data and global evidence, I think it is very important that we take a critical look because data speaks volumes. Data will inform decisions. Data will inform policy direction. I think before we gathered ourselves here, we had a country survey, country-to-country survey. I was thinking that the content of the survey will be brought to bear so that it will inform policy direction and decisions. Either funding, which area of traditional medicine in country do we want to support? Do we want to reiterate? Do we want to train? I think taking from whatever decision will be taken from here, there should be a communique. And that communique must be communicated to all the ministers of health globally, like my brother said, to inform policy direction regarding the new vision of WHO so that one earth, one family, and one destiny or one future will be achieved. Long live World Health Organization, long live traditional and complementary medicine, and long live all of us.
Thank you very much. Thank you. That's very kind of you. I see one last. I've been told that I have disregarded my reputation of being on time, but I still have one last question because I know she's been standing here. I encourage everyone to please come afterwards to please ask the questions. This gentleman has a mic, maybe 10 seconds or 15 seconds, and then the question there, and then we'll stop after that. Please.
Thank you. Thank you, Mr. Samir. I'll be short and brief. I'm Dr. Punanan Rajaran from Mauritius. Because my colleagues from Africa have put up some points which I couldn't put up yesterday, I'll take 2 minutes. First one is yesterday, Dr. Tracy, she very well told that the empowering of the people is very important. And if we want to go for health for all, inclusion for all, I feel that much of the knowledge of self-health care is lying with our religious people. Those people who are teaching the priest and all, because I happen to come along one of the texts, and the first chapter in that text, it is Gruhastha Nitya Karma. It means what the person has to do in his home for his self-health care. This is one. Secondly is...
Sir, please, quickly, I mean, other panelists are waiting, so if you can come to your comment, thank you.
Second thing is universal health care will not come if we don't have, it is a quote from Gita, Daya Sarva Bhuteshu Santustya Yena Kenava Sarvendriya Upshantyascha Tustyashu Janardhanam. We have to have passion and we have to have care for every living things, whether it is human, animal, or plants. Second, we must be happy with what we have. Third, we have to have control in our senses. My small question to Dr. Bhavna, who is doing very great in the field of Ayurgenomics. Madam, what is the youngest age for us to go for Prakriti diagnosis? One, because the population who are suffering from NCD, it has gone down. We happen to see very youngsters developing type 2 diabetes.
Sir, if I may object, I know you have a direct question for Dr. Bhavna. May I request you that after the session, if you can please clarify these questions. Apologies, I have been pushed back and forth here, but 3 times to say that we have submit, and I don't want to disregard the 2 ladies who are standing there. Very quickly, please, 10 seconds.
Thank you, Inanway.
And then the lady in the middle side there. Please go ahead at the back.
Thank you. Wonderful session. We enjoyed all the speakers' talk here. I'm Santoshi Narayanan. I practice integrative oncology at MD Anderson Cancer Center, Houston, Texas. So my question is on the space of AI, bridging the gap between conventional medicine practitioners and traditional medicine practitioners, because I see that there is a big gap, and some of the reason for some of these challenges because of lack of knowledge. The conventional physicians may not understand the terms that, for example, Ayurvedic practitioners use, and Ayurvedic physicians may not understand all the terms, and this may not be clear to the policymakers. So I see that this is a huge opportunity for AI to bridge this gap. So my question to the speakers is that what efforts has already been done? Because I hear both speakers, both question from African colleagues here, and they are facing the same problem, the gap between the traditional healers and the conventional doctors. So how could we use AI in this space to narrow the gap for this?
Thank you so much. And I'll also request ma'am to pose a question and then we can quickly react to that. You had a question, sir, ma'am.
I hope I'm audible. So thank you so much. This is Madhu Dikshit. I am from CDRI, Lucknow. I have been into new drug discovery by modern science and recently are being exposed to the Ayurvedic drug discovery and development. My concern is that when we see modern science, clinically there are normalized parameters which are available for the normal healthy population. But in Ayurveda, we see different prakriti, doshas, and the cusps. Is there any data which is actually representing for different populations? Second thing is, then when we give treatments, how they are responding and what sort of outcome is there? If AI can develop these tools and this information, that will be very, very useful, in my opinion. Thank you so much.
Will respond in 2 sentences. For Santoshi's question, there is an example that in ICD-11, this traditional medicine chapter, this integration is happening. So this morbidity codes of Ayurveda, Siddha, Unani has translation into the modern terminology. So there is an interface of understanding between these two systems. So that's an example. That kind of multiple examples can be cited. And for Dr. Madhu Dikshit ji, actually she is an Ayush chair and she knows about that there's huge data sets are being generated, and I mentioned about this AHMIS where we are going to integrate all those informations. Thank you so much.
Thank you so much. I know there's still many more questions, so please feel free to reach out to the panelists and the communications and the emails. I again thank you all with the message that AI is here. Let's make it safe and let's make it scientific to be deployed. AI can do a lot of things for us future, except for the dancing and the singing. So enjoy that as you do it. Thank you so much and enjoy your break.
We have tea outside. At the same time, I would request that we will restart the session, the plenary on integrative medicine, at 12 o'clock. We have exactly 20 minutes. So if you are back by 12 o'clock, we will be able to attend and, and then complete the session within the time available for us.